This video will provide an overview of the required vaccines and tests that are needed to participate in the nursing program at Kellogg Community College. The first is the chickenpox. CDC recommends 2 doses of the chickenpox vaccine for children, adolescents, and adults who have never had chickenpox and who have never been vaccinated. There are 2 ways to meet this requirement: a varicella titer blood draw that indicates immunity, or 2 doses of the varicella booster vaccine. Please note that providing a past report of chickenpox or an MICIR stating immune is unacceptable for showing immunity. Next is the COVID-19 vaccination, which is recommended for Kellogg Community College nursing program. Moderna, Pfizer, or Johnson & Johnson COVID-19 vaccinations are acceptable. Please submit a copy of your vaccination card through ACEMAP. Please note that some of the clinical placement partners may require either a medical or religious exemption. If you would like to request a medical or religious exemption, please be aware that you must fulfill any exemption process required by each clinical site to which you are assigned. It's important to note that not all sites may grant exemptions. Please email nursing@kellogg.edu as soon as possible for any exemption request forms or to address any questions you have. A medical and religious exemption request are available at the end of the nursing packet. The measles, mumps, and rubella, or MMR vaccine, is needed to protect against 3 potentially serious illnesses. It's a 2-part vaccination. Speak with your doctor if you are unsure if you are up to date with the MMR vaccine. Your doctor will be able to access your vaccination record online. If your vaccination records are unavailable or do not exist, there is no harm in receiving the MMR vaccine again. To be eligible for KCC's nursing program, students are required to have received 2 doses of the MMR vaccine or provide evidence of immunity through a positive titer blood draw. The MMR vaccine is part of the medical history questionnaire. More information regarding the MMR vaccine from the Center of Disease Control can be found at the end of the nursing packet. The Tdap vaccine protects against tinnitus, diphtheria, and whooping cough, and prevents the spread of disease to others. Tinnitus and or tinnitus diphtheria vaccines are insignificant for the Tdap requirement. You must have received 1 dose in the past 10 years to complete this requirement. The Tdap question is part of the medical history questionnaire. More information regarding the Tdap from the Center for Disease Control can be found at the end of the nursing packet. Tuberculosis, or TB, is caused by a bacteria called Mycobacterium tuberculosis. The bacteria usually attacks the lungs, but TB bacteria can attack any part of the body, such as the kidney, spine, and brain. Due to the risk of exposure in a clinical setting, nursing students must select one of the following options: receive a BCG vaccine. People previously vaccinated with the BCG may receive a TB skin test to test for TB infection, TB blood draw test, the quantiferon TB gold blood test, or a chest x-ray. The TB question is part of the medical history questionnaire. More information regarding the TB vaccine can be found at the end of the nursing packet. Hepatitis B is a liver disease that can cause mild illness lasting a few weeks or lead to serious lifelong illness. Due to the risk of exposure in a clinical setting, nursing students must select one of the following options: decline vaccination. To elect this option, complete the KCC Hep B form and upload it to ACEMAP. Provide documentation that you have completed the hepatitis B vaccine series. To elect this option, complete the KCC Hep B form and upload it to AceMap. Provide documentation that you have had a blood draw completed that shows you have immunity. This option can be elected by completing the KCC Hep B form and uploading it to AceMap. All three options require you to sign and date the Hep B form. Information regarding hepatitis B and the vaccine from the U.S. Department of Health and Human Services can be found at the end of the nursing packet. If you have questions about any of the vaccine requirements, please reach out to the nursing department at the phone number provided on the screen.